beyond, it's a very interesting story. The CT scan showed that both lung arteries are packed, completely blocked with clot.
Most doctors would probably just give up and say they already gone. I was grateful that I hear I wanted a chance and see my family.
I had episodes where I lost control of my legs and arm.
When the scan was done, what we found is that he did not have a stroke, but he actually had a tumor on the left side of his brain, which is why the neurosurgery team decided that we should go ahead with an awake craniotomy.
So it is just that it is done while the patient is kept awake. So it is called an awake craniotomy. This is the first operation of this nature in Health City. But fortunately for us, we had the entire team. So it was right from the technicians to the nurses to the anesthetists to the surgical team. Everybody has been the same team that was performing these surgeries in India, and we could have the entire team with all their expertise to do this procedure here.
To lengthen my leg, well, I didn't know. My mommy didn't know. Like when I was like a baby, but she wanted to do it. My leg was short when I was born. Sometimes I used to get pain.
This is the first time where lengthening has been tried in Health City, and Charlie beam is one rare case where a combination of deformity correction, lengthening, all these things, pediatric surgery, all these things come together.
The concept of limb lengthening means that we can actually make people taller by expanding their bones, especially in the lower limbs. One of the biggest advantages of the limb lengthening using the precise nail is a painful and difficult procedure has been simplified and has been made painless, and also, not to mention, minimally invasive.
This small boy Jeremiah, small cute child, 10-month-old, of a very young parents. What happened to the child is when the child born, the parents noticed there is a pulsatile swelling in the upper abdomen. The heart is coming out here. Actually, that heart is just beneath the skin. The heart is there. Any trauma, anything can actually, even if you press hard also, that can even kill the baby. Now he is like normal any other child because all the problems are sorted out, and we have done echo after that multiple times. Everything is fine. Child will have a normal life now.
I would definitely recommend Health City to anyone, anytime. With my past experience with them, I definitely would.
This is specifically used in patients with congestive heart failure where the heart pumping function has come down in spite of medications. This is the first time we have introduced this device in the entire Caribbean. In that sense, I think we have introduced yet another novel therapy in the region.
Dr. Renga's, he's kind of quiet, but he's very into, making sure everything's perfect, making sure everything goes well. If you have any questions, he answers them very well. Dr. Renga makes sure you're comfortable. He makes sure that you go in and everything's taken care of. And I saw him often, which was awesome.
I knew straight away that she was a really good candidate for this procedure. And it's my personal belief that the patient's attitude, all of these are very important in the patient's outcome, no matter how good a job you do as a surgeon.
It's an excellent facility, and I'm so happy that it's close to Jamaica.
We are possibly the only hospital in the whole of Caribbean who have this technology. Outcome has been fantastic in all the 5 patients. So they all were sent home in a day, and they all had very effective elimination of the intended target.
Mr. Cluster, I would say he is very lucky to be on the islands, at the right time, because the one manifestation that he had is called leptospiral pulmonary hemorrhagic syndrome.
And this was the very first veno-venous ECMO that we did.
I remain grateful to the team at Health City for the work they did in making sure that it's alive today to tell the story.